Here we're going to do a primer on gross anatomy of the cardiovascular system. Now there are a lot of tutorials here. We'll go through the cardiorespiratory system, the heart itself, trunk walls, viscera, and extremities. But if you pay attention to the primary tributaries, the origination of the vasculature, then the branches just become details that you'll learn over time. Let's start with the mediastinum, this central region here. It's located between the right and left pleural cavities. We can see it in that teal cover. We're going to go through the superior, anterior, and middle and posterior divisions. Here is the anatomy itself. This is just helpful for general landmarks of this truncal region. So superior up here, pass from the head and neck to the thorax. Anterior here, close to the surface of the body. Middle here with the heart and the great vessels in here. And then the posterior mediastinum, structures pass through the thorax, for instance, the esophagus and thoracic aorta here. Moving on to cardiovascular system, arteries versus veins. Veins carry blood to the heart, arteries carry blood away from the heart. So let's see what that means with these two different circulation systems. So here's our heart here. From the pulmonary standpoint, the pulmonary artery carries poorly oxygenated blood to the lungs. The pulmonary vein carries well oxygenated blood back to the heart. And then from systemic circulation, the oxygenated blood goes through the systemic arteries, and then the systemic veins carry the poorly oxygenated or deoxygenated blood back to the heart. We're going to start here with the aortic arch. We see the carotid and subclavian arteries here, and then we have the descending aorta, thoracic and abdominal segments. Thoracic means superior to the diaphragm, abdominal inferior to the diaphragm. We have the aortic bifurcation with the iliac arteries. And then we have the ascending aorta feeding the coronary arteries. Arteries of the head and neck. So brachiocephalic trunk divides into the subclavian artery and the common carotid artery. So this is some complicated anatomy here. Here's our brachiocephalic trunk, here's our subclavian artery, and here's our common carotid artery. Subclavian then gives off the vertebral artery back here and several other arteries. And then the common carotid divides into an internal carotid and an external carotid here. So this is just so we can see this a little bit more clearly. Again, brachiocephalic trunk to subclavian to common carotid. In diagrammatic fashion over here, we bring in this earlier image so we can compare it. This is coronal view and sagittal here. Again, brachiocephalic trunk, common, subclavian. Really core anatomy to know. Now there's a caveat, and that is that the brachiocephalic trunk is only on the right side. So the common carotid, here's its takeoff on the right side. On the left side, there's no brachiocephalic trunk. And then the common carotid divides into the internal and external carotids, and the subclavian divides into the vertebral artery and other arteries as well. Now for the veins of the head and neck, the subclavian and then the internal jugular vein instead of the carotid then dump into the brachiocephalic vein. So here's our little simplistic tree, and here is our internal jugular here, here's our subclavian vein here, and then here's the brachiocephalic vein, and then there's additional venous structures that are all dumping into this brachiocephalic. For the heart itself, so from superficial to the deepest layer, we have the pericardium on the outside, and then the heart wall, and these are the layers as they move from superficial to deep. So here is our diagram. Pericardium, again, this is the most superficial. We can also set this up so that we can see the serous layer here is deeper, most superficial out here is the fibrous layer, and then when it comes to the heart wall itself, the epicardium is superficial here, and the endocardium here is the deepest layer. External anatomy of the heart. We're just going to go over some major structures here. So here they are, the atria, ventricles, aorta, pulmonary artery, pulmonary veins, and the vena cava. So let's point them all out. Atria up top here, ventricles, big muscular walls down here, and then the aorta here, pumping blood out to the body, and then the pulmonary arteries here. So blood is being pumped to the arteries there, pulmonary veins being dumped back into the heart, vena cava for venous return of blood flow that goes into the heart. Internal anatomy, same structures. Again, complicated anatomy, which you'll learn very well, but let's just point out the big stuff here. Left atrium here, pulmonary artery running up here, aorta pumping out of the left ventricle, and then the vena cava dumping back into the right atrium there. This is a pictorial. We took MRI slices and gave it some action here. So this is normal pumping of the heart. This is the aorta, the atria, and the ventricles. And then this is how it gets boggy in congestive heart failure. And there are flashcards with videos on the site to demonstrate this anatomy and pathophysiology. So the arteries of the heart itself, the coronary arteries. So this is the pathway of arterial flow. Things get a little bit more complicated than what we've seen earlier. The aorta to the right coronary and the left coronary. We can see that here, aorta and the right coronary and left coronary here. They then extend out to multiple different arteries. We're just pointing out the left anterior descending, the LAD. Now this is also known as the anterior interventricular artery, and we're pointing it out here. This is the LAD here. Very important one in myocardial infarction because it's such a key supplier of the heart. And then this is our simplistic diagram to take away the heart itself so we can just see the general layout of the arteries here. Again, right coronary, left coronary, aorta laid out for us. So let's layer in some additional artery structures, left marginal, right marginal, and then we've got our LAD pointed out. Cardiac veins. This is our general flow. Vena cava to right atrium, to right ventricle, to pulmonary artery, to the lungs for oxygenation. So here's our heart, anterior cardiac veins, and coronary sinus, both dump into the right atrium. This is the general flow. If you just take that away from this primer, that would be plenty. So here's the heart and the veins drawn out for us. Again, a simplistic diagram over here that we can follow. Here's our anterior cardiac veins. Here's our coronary sinus, all dumping into the right atrium here. And here they are. So coronary sinus here, anterior cardiac veins, and then these are the additional veins that supply those before they dump in. Blood flow through the heart, lungs, and body. Okay, so here's our heart, right atrium to right ventricle, left atrium to left ventricle. We're adding in the respiratory tree here. It's going in through the pulmonary artery, lungs, gets oxygenated, pulmonary veins spit out the oxygenated blood. Left ventricle then goes to systemic arteries, body, and back through the loop, coming from the vena cava into the right atrium. So here is our diagram. Again, complicated anatomy, but you'll learn it very well with all the valves pointed out and vasculature, etc. So again, right atrium dumps blood, right ventricle, pulmonary artery, tree, back to the left ventricle and out to the body tissues. And here is the aorta being pointed out right here. Moving away from the heart, celiac trunk. Three key branches I want to hammer home in this primer. Left gastric artery, splenic artery, common hepatic artery. Here we go. Left gastric, splenic, common hepatic. Celiac trunk, left gastric with esophageal branches. Splenic artery has these other short gastric arteries, and left gastro-omental artery, and then the common hepatic artery has a breakdown as well that you can see there. Celiac trunk, right side, left side, descending abdominal aorta, and then this is our common hepatic artery with additional vasculature coming off of there. And then we have the left gastric artery. Let's add in some of the organs here. Here's the stomach and spleen and the liver itself. And then this is this left gastro-omental artery and the right gastro-omental artery meeting up here, and the splenic artery over here. Moving to the thoracic and abdominal wall arteries, let's just jump right in because this gets a little bit complicated quick, so I want to give some time here. So this is our arteriovasculature we've already established, and we'll see here, we already set all this up, so we know this already. So now let's jump into first the thoracic arteries. So these are anterior intercostal arteries and posterior intercostal arteries. Then the abdominal. So this gets a little bit more tricky. So we have first this posterior wall with these lumbar arteries and median sacral artery. We can see that here. This is the median sacral right here, and then the lumbar arteries. Then we have the anterior wall with the superior and inferior epigastric arteries pointed out here and inferior here, referencing what's happening down in here. And then we have the anterolateral wall with the subcostal and then the ascending branch of the deep circumflex. So here's the ascending branch here and then the subcostal artery here. And you'll learn that in detail in the tutorial itself. So moving on to the veins, similar tree, similar setup here. So here's our internal thoracic vein here. That's a key one to point out. And then we point out the azygous vein here. And then for the abdominal wall, we point out the iliolumbar vein. So common iliac vein to inferior vena cava. And then we have our superior vena cava dumping in to that right atrium. Some clinical correlations here, alternate venous drainage from the ascending lumbar veins, and then the azygous vein, alternative venous drainage pathway if the superior vena cava is blocked. So superior vena cava is blocked, think azygous, inferior vena cava is blocked, think ascending lumbar veins. The hepatic portal system. So the primary vessels transport blood from the stomach, spleen, pancreas, intestines to the liver. And these are the primary vessels right here, hepatic portal vein, splenic vein. This is our little tree structure here. So we have splenic vein, hepatic portal, superior mesenteric, and then inferior mesenteric over here. This is our basic organ system setup. Splenic vein, we see the spleen here. Inferior mesenteric, this is mesentery here, superior mesenteric here, and then hepatic portal vein. Now these are hepatic veins themselves, so the hepatic portal vein transports blood to the liver, whereas the hepatic veins themselves transport blood away from the liver. So that's an important distinction to make. And then this is additional venous vasculature. Mesenteric arteries, a few to point out. This will be a simple diagram. Superior mesenteric artery, inferior, and then marginal artery. Superior mesenteric here, marginal here, and then inferior mesenteric here. So simple tree structure there, and then this is additional vasculature. Internal iliac artery, just want to point out the difference between anterior and posterior here. So this is the basic musculoskeletal system setup with some key organs. We have learned this already, the common iliac artery branching off into the internal and the external. And then we have this anterior division here, and then we have our posterior division here. Extremities. Arteries of the upper extremity, subclavian feeds axillary, feeds brachial, and then brachial feeds radial and ulnar. This is our basic musculoskeletal setup. Again, we've already established this anatomy. We already know it cold. We learned it here. And now we're going to add in the arteries of the limb itself. So subclavian, axillary, brachial, all referencing things that we learned about in the musculoskeletal anatomy itself. And then radial down here, ulnar. Remember, in anatomical position, the ulnar is medial and the radial is lateral. And then this is additional arterial vasculature that you'll learn in the tutorial itself. Veins of the upper extremity, key distinction here. Superficial veins, cephalic laterally, basilic medially. We'll see that in a little bit. And then the deep, they share the names with the arteries. So we already know them. So we jump right in. We've got our primary tree, our deep veins already set up here, superior vena cava, and then so subclavian, axillary, brachial, and then radial and ulnar, following what we saw with the arteries. And then we layer in the superficial. So cephalic over here laterally and basilic over here medially. Finally, arteries of the lower extremity. We saw this earlier, aorta, the common iliac, with the internal here and the external here. That's a core tree structure there. We're going to use a flow diagram on this side to kind of follow along with how this arterial tree structure works. Internal iliac, again, we've already pointed this out. And this dumps into the femoral, which then has a deep femoral and some branch point with a circumflex artery. And we see that over here, femoral, deep femoral here, and then through to popliteal. And then this is additional arterial vasculature that you'll learn when you go through the tutorial. Veins of the lower extremity, very similar setup. So we have our inferior vena cava, we have our common iliac with our internal iliac and external iliac, and then we have our femoral vein and great saphenous vein, which we'll point out in the diagram. Again, deep veins share the names of the arteries, receive blood from superficial veins, and then the superficial, the great saphenous, and then the small saphenous here. Here's our tree structure. Here's our great saphenous vein, and this is what we pointed out over here. So that's our gross anatomy of the cardiovascular system. A lot of details there, but if you pay attention to those primary tributaries, then the branches just become details that you can learn over time.